Good evening. My name is Shamika Rhymes, and welcome to the third annual Healthy Kids Summit hosted by blackdoctor.org. Drop in the comments where you're watching from. This is in partnership with the Chicago Urban League and Cedars Sinai. And I am super excited tonight because this year's theme is Energize, Educate, and Empower, which allows us to focus on the health and well being of your children, especially as they're heading back to school. And it will also empower you as parents to ensure that your child is staying healthy. So tonight we're taking a look at vaccines and vaccinations. There's been a lot of talk in the news over the past few years about whether or not you should vaccinate your child. But we have the experts here to talk about it. So joining me on the panel tonight to discuss this important topic, we have Calmetta Coleman, Chief Operations Officer of Chicago Urban League. Hi, Calmetta. And then we've got Phyllis Arthur, Vice President for Infectious Diseases and Diagnostics, I cannot talk tonight, Policy, Biotechnology, Innovation Organization, and which is also we're partnershipped with you guys as well. So thank you for joining us. And then we have Dr. Rosha McCoy. She's the Senior Director for Clinical Leadership and Quality, AAMC. And then we have also Eloise Black, and she's a clinical informatics leader. Welcome. How are y'all?
Good.
Wonderful.
Glad to see you all here. So we're going to kick this off. I'm just going to kick the question out there, and whoever wants to answer first, feel free, or I can, like the teacher in the classroom, I can pick on somebody, or you can raise your hand, however you guys want to do it. So what are some common concerns that parents have about vaccines and vaccinations? Because I'm sure there are a ton. I'm going to pick somebody.
Okay. So I think the most common issue is usually the side effects. You know, of course, no one wants their child to get sick from something that's supposed to be a preventative measure. A lot of times it's the lack of information or the misinformation that's received about various vaccines and things that are supposed to help the children. And if they get a piece of wrong information, it's like they hold on tight to it and run with it. So we have to do our best to try to educate and provide the appropriate information about all the vaccines that are very helpful for our children, because most of the time all the time, I should say, the benefits will outweigh the side effects. So we have to get that kind of thinking ahead of these misconceptions about vaccines.
Yeah, and I think the other thing that the parents want to know is what are truly trusted sources of information. Where can they go? The internet, etc., is so full of, it makes your mind it's mind-boggling, right? To try to find information. So where are good sources of information? What can they trust? And parents have certain communities have inherent distrust in certain things, and rightly so. So we have to recognize that, and we have to really think about safety and then have an honest conversation with folks.
Okay.
I think there's one last concern I would raise that we hear, particularly when parents are thinking about the pediatric schedule under 2 years old, where there are a lot of vaccines, is some people worry, like, am I overloading my child's immune system? And the data is actually quite rigorous about the fact that children's immune systems at that age can indeed take the high number of vaccines. They are spaced out and studied during the clinical trial part. They are studied together to make sure that one vaccine added to the schedule doesn't impact the effectiveness or the power of another vaccine given at the same time. So I think parents sometimes wonder, particularly in that under 2, whether there's too many immunizations at once. And I think pediatricians and nurses are very helpful in explaining to parents that actually their children's immune system can respond to, say, 2 or 3 vaccines in a 2, 3, 4-month period.
One other thing that I would add for a lot of the communities that we serve through the Chicago Urban League is we were talking earlier about mistrust and distrust. We also see like concerns about costs, like people might not have the information to understand that there might be access to free vaccines and those kinds of issues. And so some people simply don't bother to take their kids to get vaccinated because they are concerned about costs.
add to that, Shamika, that's super important because over the last 5 or 10 years, by and large, legislation both at the federal and the state level has been done to ensure that almost all Americans from 0 years old to over 65 actually can access vaccines with a healthcare provider in a community health center, at a fully qualified health center, at a pharmacy with zero outlay of cash. Right.
Yeah.
And so particularly in children under 18, your children should be able to get either a federally funded dose for free at the pediatrician, that's called Vaccines for Children, or if you're insured, your insurer should cover those vaccines with zero outlay by you. So I agree with what Carmen is saying. People may still be under the impression that they're going to have to spend money on the vaccines at the doctor or the pharmacy if you're vaccinating a teenager. That should not happen given the regulations on insurance coverage.
Thank you for highlighting that, because I wasn't aware of that either. So I'm sure a lot of people watching are glad to hear that. Why is it so important for parents to be informed about vaccines?
Well, I think it's part of the whole picture of keeping children healthy, right? So as we talk to parents about their children, children don't get sick as often, right? It's really about keeping them healthy. So we talk about nutrition, we talk about development, we talk about all of those things to get them through a healthy childhood, attending school, and then into adulthood. So it's part of the whole picture of keeping kids healthy. Vaccines have been historically important, right? I think people forget history. Is that in our grandparents' time, our great-grandparents' time, children died from all these diseases. They did not live beyond their first year of life quite often. So these have been life-saving, and around the world there's still children dying of these diseases because they don't have access. Some in this country as well. It's pretty rare here. So I think it's just important to think about the whole picture of keeping kids healthy.
Okay, thank you.
I think the other thing we've seen is vaccinating across the lifespan reinforces protecting people in the small unit of the family. So you absolutely want to keep a kid healthy, but you also, to some degree, are keeping the whole family healthy as well, because these are diseases that go from person to person. I mean, all of us have been in a family where a cold just went straight through the entire family from baby all the way to grandma. And so I think that vaccinations actually help both protect the individual particularly, but also the entire close community or close family that they are with. And we saw that a lot during COVID, how important it was to have vaccination across the family to protect each other as well.
Yeah, and I would add to that, Dr. McCoy mentioned it briefly, but the idea of even just being able to go to school, because schools generally require it, but increasingly in Chicago, we're seeing kids still showing up on that first day of school, even into that first week of school, not vaccinated, and that means that at some point they will be sent home. And so in order for them to really be able to stay in school, get that quality education, and keep their classmates healthy, it really is important.
Right. So in the health and hospital system that I work for, we were very big in the community with the COVID vaccines. We had a lot of pop-up sites administering vaccines where we did entire families, and the lines and the waits were, long in the beginning, but now we are doing those things inside of our clinics on a regular basis. And fortunately, our patients know that we are there to support them in whatever they need. We, like you said, for the BFC vaccines, we do have those vaccines that are, free or administered through if they have insurance. But we also help them fill out for different programs to ensure that they have what they need to support them and their family as they move forward throughout their life span.
Thank you. Dr. McCoy, I'm going to start with you on this question. How do vaccines work to protect children from diseases?
Sure. Vaccines really work with your immune system, right? So they fight infectious diseases by sparking your immune system, helping your body fight off and remember this germ, right? It sees this germ once, and if it sees it again and you've had the vaccine, then your immune system fights it off again. In some cases, you won't get the disease at all. In other cases, it'll be a less serious infection. Some parents wonder, well, couldn't they just get the infection and wouldn't that be better? There's no evidence that just getting the infection, like, we got chickenpox, why shouldn't our kids get chickenpox? Well, chickenpox comes with some serious complications. There are, a number of kids who get pneumonia and can get very sick with chickenpox. And as the older you get, the more likely you're going to be to get sicker, right? So I think it's how it's a remarkable way that vaccines work with your own immune system to really make it work better.
Thank you. Anyone else want to weigh in on that?
I wish that was beautiful.
Well, I take that from you, Phyllis, as a compliment. Thank you so
much. Well, for the past 3 years, Urban League affiliates across the country have been working to increase access to COVID and flu vaccines. So how does the vaccine access, which we kind of talked about a little bit already, but how does it relate to the Chicago Urban League's mission of racial equality? And I guess this one is for Calmetta.
Thank you for asking that, Shamika. So at first I'll start talking about what our mission is. So as the Chicago Urban League, our mission really is focused on achieving racial and economic equity for Black families and communities. And so we know that means, we look at things like the racial wealth gap and, what is happening in our communities in terms of inequity, in terms of employment and all of those things. And what we hear is from, our clients who we train to prepare for jobs, for our youth, the people who we help with housing, we hear repeatedly that, yep, we got them a job, but they couldn't go to work because they were sick and they maybe didn't have access to jobs. And so we are really looking across the National Urban League, but certainly in Chicago, at those social determinants of health. And so we see the access to vaccines really as one of those, right? So prior to COVID, we were doing some things in the health space, but not directly providing access to any kind of care. And so we have really now, since COVID and the impact that we saw that had in our communities disproportionately, we are really looking at, what are all those ways that we can really increase access to quality healthcare and all the areas that helps improve in your life. If you're not healthy, that really affects your ability to get to work, to run your own business if you have your own business, all of those things that really help us address those racial and economic disparities.
Thank you for that. So that brings me to my next question, because I see it all the time on social media, and I'm sure you guys have too, where people are saying, oh, if you vaccinate your child, this can happen or this can happen. But I'm bringing this question to all of you. What are some potential side effects of vaccines and how common are they?
I don't know, Dr. McCoy, you want to start? I can.
Sure. I can start, but please weigh in. I'm sure Eloise and others have good information. I mean, I think one of the things I say to parents is there's nothing that's without risk, right? So going out the door today is going to carry a small risk. But most of the time, most kids don't even feel side effects, right? I mean, it's much more common for adults to have side effects of vaccines than kids to have. But there are some kids who the most common side effect is pain at the injection site. So you're going to see a little bit of swelling, a little bit of pain at the injection site. Some kids can have a little bit of fever. Just, babies might be a little fussier just because they don't feel as good. They may have some body aches, that kind of thing. There are a couple vaccines that may cause side effects later, like the measles, mumps, and rubella vaccine or chickenpox vaccine. The child might get a fever maybe 1 to 4 weeks later, or a little bit of a rash. So those are all things hopefully we're talking to parents about, to think about what to expect, what's unusual, what we want to hear about, what is to be expected. And then there are, the rare things like a severe allergic reaction. Obviously, you're getting the vaccine in a physician's office or a hospital. People are prepared to deal with those. And then there are some rare things that happen that we do need to make sure parents understand that those are rare, but we want to make sure we're sharing all the information.
Okay. Eloise, did you have anything to add to that?
The only thing that I would like to add to that is that parents with their personal experience. So if I had my own personal experience and I had, say, like a flu vaccine and I had a mild illness afterwards, I'll have the experience and say, oh, that flu vaccine gave me, the flu. So in that, I think that prevents and hinders the movement of moving forward of parents getting their children vaccinated as well. Because if they have a bad experience themselves, they don't want their child to feel that kind of sickness, illness, without they don't understand that was just, like a mild illness and it could have been worse without the vaccine, so that's part of the education that we have to continue to try to move forward with our parents in the community. Because like you said before, with people being able to go on the internet, we are all Google doctors. All of a sudden, we're all Google doctors, right? So anything they see, and the first thing that pops up is like the most common search. And then it's not even, accredited or, something that's factual. It's someone's opinion and they don't even realize that. And then all of a sudden I have this disease. I read it on the internet. No, you don't have that, so it's kind of challenging with so much information being at our fingertips.
Thank you for that. That just reminded me, my grandma would always say, don't get that flu shot because it'll give you the flu. And for years, I thought that was right, but clearly it's not.
Right. And it's, I'm sorry, one more thing. I had my own experience with that as well, because I would never get it. But when I sat down and I had a talk with an infectious disease doctor that I work with, and he broke everything down to me, see, it was the education that helped me make informed decisions. So we have to have those conversations to get our parents and, just people in general, give them the education, the insight to understand what it is, the side effects, the benefits, and then it'll change their mind.
Yeah. I'd like to add one thing that I know as we have been talking to people over the past 3 years about vaccines for both flu and COVID and other things. I often hear people fall back on in the Black community. Oh, well, I'd have Jesus. That's enough. I just got God. I would pray on it. I mean, seriously. And I think some of that maybe is to cover fear and other things. But, people take that seriously. They feel like, oh, I'm leaning on God. And so I don't need that vaccine. I have something else. And so I think that really speaks to the need for education around the topic. So.
Yeah, thank you.
In terms of I'm going to add just to what Dr. McCoy said, the pediatric vaccines in particular have really rich, broad data. They've been given over many, many years to millions of children and worldwide. Like the measles, mumps, rubella vaccine is given around the world to actually billions of kids since the 60s. And so I think that the way Dr. McCoy described the relatively common side effects, the pain at the injection site, fever in kids, particularly if they're getting 2 or 3 vaccines at one time, I think it's extraordinarily common. And the 1% or less than 1% kind of side effects have stayed at that level over millions of doses over years. And so I think it's important to think about the denominator over these side effects as well, and to say it's not that they never occur, but in the grand scheme of things, most children's risk, particularly in that under 5 set of vaccines, right, and also the adolescent vaccines, have been demonstrated to stay very much at low levels over many, many years of giving those vaccines routinely.
Yeah, I mean, Phyllis is totally right. I think the other thing, though, that does happen, and she described this exactly right, the other thing that happens is that babies particularly get a lot of vaccines in their early life, right? And some of those babies get sick with other things. And if you look back at their life, a month ago they got a vaccine. So we all, parents naturally want to relate that to the vaccine. But you really have to look at the big picture. And most of the time it's not related to the vaccine. It's just it's just the timing. So, we all want to find a cause for things. And so sometimes people want to relate that to a vaccine, but the evidence is very clear that that's not what's happening.
Okay. Phyllis, I'm going to direct this one. I'm going to start with you first on this one. Your turn. How are vaccines tested and monitored for safety?
That's a great question. So, as everyone knows, vaccines are developed by the industry I represent. So, I work at a trade association represents companies that make vaccines, develop and make vaccines. Companies actually go through a very rigorous process of doing clinical trials around the world with children or adolescents or adults in the right ages. They work very closely with the FDA on designing those trials to actually be able to look for the most common side effects. So the trial sizes are actually much bigger than they are for drugs because we're giving these products to healthy people and particularly healthy children. Yeah. So companies are very vigilant about the way they build those trials. They actually have independent, non-paid data groups, data doctors that look at the safety data blinded. And those people really do assess whether the safety is there even before you finish working with the FDA. In addition, the CDC actually also looks at the data, and they have multiple different mechanisms for looking at the data, both in the trials and then once the product goes on the market. So we never stop looking at the safety data over time, never. So even like for something like measles, mumps, and rubella that's 20 years old, there are still ongoing analyses going on the safety to look for anything that could be 5, 10, 20, 30 years. Most of the side effects, as Dr. McCoy said, happen within the first couple of days or the first couple of weeks after vaccination, but the safety monitoring goes on for decades after a vaccine is launched on the marketplace, and the CDC and the FDA continue to analyze it, and companies continuously report any data they see over the course of the life of the product.
Thank you for that, because I think sometimes, especially with the COVID vaccines, you started to hear a lot of people say, oh, it hasn't been tested or studied as much. So I think this gives some perspective of it's still being studied and tested, as each
COVID trials were some of the biggest trials we've ever done for vaccines. They were 30,000 people because we had so many ages to cover. And those trials were huge. Mm-hmm. And many of the people on those trials are still being followed, as well as continuing to use the data monitoring system in the U.S. to follow safety.
Okay.
Yeah, well, beautifully said. Thank you.
Yeah. Did you have anything else to add, Dr. McCoy?
No, I think that last part about how vaccines continue to be monitored, I think is probably the most important part for parents and families to know. I think Phyllis said it very well. Yeah. It's not like something is looked at and then we stop. And then changes are made. That there are improvements made in vaccines. The whooping cough vaccine, for example, early on there were quite a few side effects with that vaccine, and that's gotten to be a better vaccine over time. It's called the acellular pertussis vaccine now. So we're seeing much less in the way of fussiness and fever that we used to see. So I think it's, improvements are made as time goes on based on that data.
Okay. Well, what would you say to parents who are hesitant or they just absolutely refuse to vaccinate their children? Because there are, say some of their favorite celebrities are saying, hey, don't vaccinate your children. And if that's kind of, they're like, well, if they said it and they didn't, then I'm not. How do you get parents to really, get educated and think about vaccinations? We will start with, let's see here, Eloise.
Well, just like we've all said already, it's challenging to change their mindset once they have gotten some misinformation or they're holding on to someone else's opinion. This is when we have to encourage them to seek their own education, to talk to their providers, to have those hard conversations, to ask those questions, about side effects, the things that'll happen if I do not get this vaccine for my child. So it's those hard conversations and continuing education. We have to get more trusted partners involved. Like we mentioned, people say, I have Jesus. Can we get our community leaders involved? Can we get the churches involved, to change their mindset, have more educational forums for people to have the opportunity to ask questions or listen to the latest data that may have been found about different vaccines and side effects. We just have to try to educate and empower people so they'll know and not have all these myths. We have to have like a myth buster communication to continue to, just continue to educate so we can keep these things at bay. So, like with the immunity, people know that when a child is born, they have a certain amount of immunity from the mom. But like you said, they get so many vaccines when they're small because now they're coming into their own and they need more protection. So we just have to get that kind of educational process started so they'll understand, everything that's happening within our body. And it's only so much protection that we naturally have that we need this additional support.
Mhm.
I'd like to jump in there because we see that a lot in terms of people who have already made up their minds, parents who have made up their minds about, I'm not going to get my child vaccinated. And it can be hard to even have a conversation with them if you start in by talking about that. And so some of the things that we have done is to fold them into other events and activities where we get you out for one thing and, maybe we have food and reason for you to bring along the kids. And as part of that conversation, we start to talk about those things. And to be frank, we find that it really works best when we also have Black doctors on hand who can talk to them, because what we hear from them once we have the Black doctors in the room with our community members, I find that many of them, it might even be their first time having a conversation with a Black doctor. And so they might trust that Black doctor who looks like them, might have things in common with them culturally over just, an ad or the doctor they're regularly seeing through their HMO or whatever that says, oh, here's a list of things you should get. And they feel more comfortable asking questions of those Black doctors when they have questions, things that they might not necessarily ask someone else. And so that's one of the things that we've been doing and trying to do more of, to actually really hear what their real concerns are and giving them a forum where they can feel comfortable talking about those things.
Thank you for sharing that.
Yeah, absolutely. I think, it has to be a collaborative conversation. It's not about I'm coming in to tell you what to do. I have a relationship, hopefully, with you. I'm in partnership with you as your child's physician to keep your child, healthy. Let's talk about how we work together to do that. It may take multiple conversations. It may, that's something we have all to be prepared for. It may involve talking to the grandmother, talking to the auntie. It may, I know in my own culture, grandmothers are very, very powerful. And now as a grandmother, I feel pretty powerful myself. So, telling folks about my own family. As when I was practicing as a young mom, saying, I immunized my own children, and now I recommend immunization for my grandchild. So really kind of bringing it to a human level, to have honest conversations, continuing to engage with that family so that they know they can bring honest questions. Nothing should be discarded as not a good question, so that we can have honest conversations, and then we can continue to try to keep their child healthy. And if they, in the end of the day, really don't want vaccines, then we're going to have to work through that. But hopefully, we'll continue to engage about it over time. That's how I've always approached it.
I'll add one last thing, which is I think we find that by and large, no one refuses all the vaccines.
Okay.
So I think the other thing is literally having that conversation about each of the things that your child needs and and talking through the risks. And it's like, okay, yes, I agree on whooping cough, pertussis. Yes, I agree on measles, mumps, rubella. I'm still concerned about this or that. And so I find a lot of physicians or nurses, let's not leave them out, are successful at having a conversation about the different things. And sometimes people are a little more worried about this than that, and getting them to accept some parts of the schedule and revisiting the rest of the schedule can end you up with a fully vaccinated child by age 2 or age 5, which is what we all want in the end.
Okay. Well,
And
Phyllis,
sorry, one more thing. Sorry. And early conversations too. I think if we start the conversations early instead of waiting until that appointment, then that'll help as well. And then your experience, if you are open to sharing your experience that you've had with the vaccine, because people, if they are talking to you, then like you said, there's their trust there. So if you're open to having a conversation with them about your own experience, then it'll help, them be more accepting of what you have to offer as well.
Thank you all for that. Phyllis, I'm going to ask you this question. What does the industry do to ensure the safety and the efficacy of these vaccines?
Yeah, so the clinical trials are a big part of it.
Okay.
But also afterwards, the companies continue to monitor, but they also continue to gather data worldwide and bring it back to the FDA and the CDC. So knowing the vaccines are often used around the world, companies will make sure that data, say, collected in Europe, in Africa with use of the vaccines and other parts of the world, that those safety data are shared with the US government and others. That actually data like that may be added to the prescribing information that you get. And I'll call out another document that I think is a really important resource that parents have, which is the CDC's Vaccine Information Statement, also called the VIS. It actually captures the most frequent side effects as well as how the vaccine is supposed to work in a very easy to use language. You can download them on the CDC website, but oftentimes the offices will give them to parents, as Eloise said, sometimes before an appointment, so parents have a chance to look it over, know what the next appointment's discussion is going to be about and which vaccines there are. And a lot of the data that goes into those things partly is generated by the CDC and partly is generated by academic institutions, universities, and partly is generated by industry.
Thank you. I know we just touched on this just a minute ago, but this one I'm going to direct towards CalMeta. But considering the issues, and everybody can answer as well, but considering the issues of distrust that we just kind of talked about, that sometimes people are like, I'm only trusting God. How can community organizations, how else can they serve as trusted messengers to educate parents? Because you brought up some great points, of getting them out there for another event and then introducing the conversation. But what are some other ways other organizations can help get the message out?
Yeah, I would say that it's for us as an urban league, we lean on what it is that we already do. So we are already serving, thousands of people each year, helping them, training them for jobs, helping them working with their children, helping them become homeowners, supporting them on their businesses. We're already doing that. And so they've come to trust us for that. And so as we're having conversations with them about that, we also can start to talk to them about other things. And so I would say that it's really important for organizations that might do other things where they already have relationships with people in the community. How can we work with those organizations to where they already have those set relationships, to also use those relationships to share information about vaccines, about health. And, we saw a lot of that during the pandemic. But, I think that's something that's valuable to continue to do. And we are continuing to incorporate that into ways that we are working with the community, because COVID was the one thing, but we know that there is health inequity across a range of areas. And so that gives us a great opportunity to be able to talk to people, as they come in for one thing. Sometimes it's just like continuing to ask them more questions, and you get to, well, here's what was really going on, because a lot of times people still don't really want to talk about health and illness, and they keep it a secret in their families, things like that. And so how do we, whatever the situation might be, how can we, through our existing relationship with them, get them to open up and maybe make referrals, right? So we develop relationships with healthcare institutions that we can refer them to.
Okay, thank you. Did anyone else have anything to add?
Yeah, I mean, that's just great work that Kamala and her organization are doing. That's exactly what we need. And one of the things we've been doing at the AAMC over the last 4 years, as part of a grant from the CDC, is helping support our academic health centers in working with their communities. So funding work, for example, in Detroit, where Henry Ford Health System went into the schools and developed health champions of teenagers in schools. And the teenagers then use social media to promote confidence in vaccines. The University of Cincinnati developed some graphic novels that they took to health fairs and to start conversations. And health champions would be the ones who did those conversations, and people from those communities who speak the language. So the graphic novels were in different languages. In the Bronx, reaching out to the West African community. Albert Einstein did some great work of going to health fairs and working directly with churches. So I think there's just a lot of work for all of us to recognize that this really does take all of us. It can't just be you go to your doctor and they talk to you about vaccines. We need everybody to help us. And really, people, we value that greatly.
Okay, these are great ways to reach out. Are there any children who should not receive certain vaccines due to medical conditions? Because I think that would probably maybe play another part of why there's that distrust there, because they aren't sure, like, should my child get this or should we stay away from it? We can start with you, Eloise.
Let's defer to the provider, to the doctor for that one.
Okay. Dr. McCoy.
Sure, I'm happy to. So it is pretty rare. There are children with some very immunocompromised, systems who may not either respond well to a vaccine or maybe shouldn't get the vaccine because of the risk. So it's not super common, but there are some cases. So it's really important for parents to talk to their healthcare provider. There are some children who have neurologic conditions like seizures, not all seizures, but if it's a seizure that's changing or hasn't been well defined yet, then the doctor may say, let's wait on the vaccine. Extremely rare. So I almost hesitate to bring it up, but it's important for parents to have that conversation. If your child has a health condition, I think it's perfectly reasonable to have, perfectly reasonable in any circumstance, but particularly in that, to just ask about the vaccine. But it's rare. Certainly, we already mentioned allergic reaction. A child with an allergic reaction one time, then we're not going to use that vaccine again. But I don't know if Phyllis has anything.
No, you mentioned the last one I was thinking of, which is allergic reactions, which is one of the ones I think we always have to be careful of with any medicine. And really, the cornerstone thing is for parents to make sure to tell the nurse, the provider, the PA, whoever it is, all the things they know about their kid in terms of what medicines they take, allergies they may have, etc., and underlying conditions in particular. I think the other thing to think about is, again, going back to that community idea, part of where your child socializes, the immunization may be important if there's a child there that can't be immunized for the exact reasons we just talked about. But I think it's definitely key that the doctor talk through each vaccine so that we understand if there's anything about your specific child or children that they need to take into account. And that may affect the choice of vaccine or the timing of vaccine. So like for flu, for example, they may want to use a different one if your child has an allergy to eggs.
Okay. Okay. Well, what if the child misses a scheduled vaccine? Does something happen, or is it just, okay, we'll get caught up as soon as possible? Or, say the child was sick and so that's what made them, sick with a cold or something, and that's why they missed it. Or if the parent their schedule just couldn't get them there to get the vaccine. What is a way that they can, what should they do? What should parents do?
That's not uncommon, and doctors and nurses are prepared for that. There are clear guidelines of how to catch kids up. For every vaccine, there are clear guidelines from the CDC. There's a chart you can look at and figure out what you're going to do to catch that child up. I think it's also important to use every visit as an opportunity to catch a child up on their vaccine. So that's something we always say. Even if your child's going in to sprain their ankle, we're going to hopefully ask you if your child's up to date on their vaccine, so we can use that as a time to catch them up, because we don't want to waste a visit. We don't want to make you come back, right?
Right.
Shouldn't prevent a child from getting a vaccine. A high fever, yes, but so that's the other thing, because babies have colds a lot, and so if we didn't vaccinate with that, we'd really be behind. So really thinking about the whole picture, but a parent shouldn't hesitate if they've missed something, because we can easily catch a child up. It's important. I mean, it's not ideal, but we can, we have a plan for that.
And with us having such a digital health record, the system is designed, the system that I work with is designed to have those alerts, so you can, let the parents know what's coming up, when this appointment should be, so they'll be aware and be prepared. And then you can have, again, pre-educational conversations instead of waiting until that appointment to say, oh, the child needs this and this is the conversation. We can have that conversation ahead of time to educate them. It'll also give them an opportunity to go ahead and look up those things as well, because we do provide them with the information to go to the CDC's website. This is a place that we always encourage them to visit, so they can get the most up-to-date and trustworthy information about vaccines. So we do try to educate our parents and our patients. And every time they come in, especially during like flu season, there's an alert that pops up that says, this person has not had a vaccine successfully documented. So we ask them on every visit. So it's education on every visit. So if they coming in once, every 3 months, every 2 months, the question is asked until the documentation is satisfied.
Well, that actually kind of leads into the next question, which you just answered a little part of that, but what other resources are available to parents for more information on vaccines and vaccination schedules? Like you mentioned, the CDC is a great resource. Are there any other places parents should look for information?
So there
I think I'm sorry, Phyllis, go ahead, sorry.
So a lot of churches and church organizations actually are producing vaccination information for both parents and for adults. And then CDC.gov that's where the vaccine information statements exist, and they are written for parents. And I think that's a great thing to do. I think you should also think of your pharmacist as someone who might be a good resource, easier to see if you want to just talk about a vaccine, even though you're having an appointment with a nurse or doctor. I will say companies also make patient information, and you can usually find it on their websites. Their information that they make actually has to go through FDA review for patients. So they don't just make it up. They actually make sure that goes through evaluation. Anything they do with regard to patients has to be tested against the legal language around, and they really just try to turn that doctor-oriented language into patient-oriented language, but that actually goes through strenuous review. So if you're looking at Pfizer or Merck or GSK, those who make the most common baby vaccines or teenage vaccines, you can also look on their sites if you want to understand something about the vaccine in particular, as one of the resources.
Thank you. Anyone else?
The American Academy of Pediatrics has a lot of information on vaccines. So I really, the AAP.org, I think is a great resource as well. I find school nurses to be a really good resource for families. So, I really encourage them to talk to their school nurse if they have questions. So lots of different places I think people can get good information.
I'll add a couple of African American organizations in particular to Calmetta's point about talking to a Black doctor. Right, the National Medical Association is the African American Physicians Association, but there's also an African American Nurses Association that actually are great on vaccines as well. And then there's a group called then there's the National Association of Negro Women that actually have been doing a ton of education on vaccines the last few years. And they actually do a lot of local programs on school immunizations in particular. They may be another resource of very nice parent education developed by an African American group.
Thank you for those resources. Those are great ones. Well, what can parents do to advocate for vaccination within their communities? Is there something that you guys would suggest?
I think National Urban League should start.
Yeah, that's a great one.
Chicago Urban League, but yes. Well, I would say, think if you have an urban league in your community, which many communities do, it's a good place to start to reach out to ask for assistance with that. But also, if it's reaching out to your local alderman, depending on what your situation is. And sometimes it could be a matter of if there is because, being in Chicago, we know that there's not always a reliable health center or hospital in every community, and particularly in underserved communities. Are there other hospitals or health centers and other places that will come out? I would say calling your city Department of Public Health or the State Department of Public Health or the County Department of Public Health, which are they are interested in keeping the whole community safe. And so there would be a likelihood that they would be willing to come out and offer some vaccines or direct people. So I think there are some resources, but oftentimes people just don't know where to turn.
I'll point to NCNW in particular, and then the National Council of Negro Women actually are an organization, I think, that are extraordinarily powerful locally. They have been doing lots of education and also have been working very closely with church communities and to some degree also with legislators at state and local legislators and leaders to make sure that all the access issues that are so important to everybody's lives are factored in at the public level. So making sure the health department's well funded, making sure the different clinics have what they need. In essence, the advocacy for the access that we talked about at the beginning of this particular show are things that people can really focus on locally, making sure that no one takes away our ability to get vaccines easily for our kids when we decide that we want our kids vaccinated, right? And so one of the things that's great about the NCNW is they work very closely with the Divine Nine and very closely with the church communities. So there's a wonderful collection of state advocates in the Black community across the country who started working closely together during COVID, but are now very much activated around routine immunization across the lifespan that I would encourage people to reach out to if you're not already connected them to your sorority or your fraternity or your church or other avenues. They are passionate and I think are extraordinarily well organized around the country.
Thank you. So as we wrap up, is there any final thoughts that you think that parents should know about vaccines and vaccinations? So we'll go around the room. We'll start with Dr. McCoy.
I think it's about using all the tools we have available to us to keep kids healthy, right? We are fortunate in this country generally that most, just like Phyllis said and others, that most kids have access to vaccines free of charge. And that's not true around the world. So we really need to use the tools that we have available to us and try to keep kids healthy, attending school, and thriving. So that's what I would really emphasize.
Okay.
And I would just like to have the parents to not be afraid to talk to the providers when you're in your visits. Ask those questions, even if it's like a myth that they've heard. Please, talk to your providers, talk to your nurses. A lot of times the nurse is the first person that they encounter. talk to the nurse if you think you don't want to have the conversation with the doctor. The nurse can bridge that gap between the patient, the parents, and the doctors, so we can start to have those open conversations and get the answers to the questions without them Googling, and they have a resource right in front of them. Mm-hmm. That's what I would say. Try to have those open conversations.
Thank you. Phyllis?
I want to come back to something Eloise was talking about, which is misinformation and where it comes from. Mm-hmm. I would really strongly encourage parents, for the love and safety of your kid, to get your information from the best possible place. It's absolutely up to parents to decide what happens to their child's health. That no one would ever challenge that. But I think that what we should think about as we're looking particularly at the Google Fest and the Google Doc that Eloise mentioned is there are people out there who actually do not have your best interests at heart when they are saying these stories. Mm-hmm. And I think we really saw that during COVID. Yeah. And so the trusted sources of data are so very important, because there are people out there spinning misinformation to our detriment as a community, and they really don't care whether that hurts us or not. Mm-hmm. And so I think the more we can have trusted sources in the Black community, like BDO itself, yeah. It is so pivotal to our own longevity and health, is to have places that we can go that we know the information will be science, it'll be for us, it'll be based on data for us. Mm-hmm. I think that's so important in this world of misinformation that we're living in now.
Thank you. Calmetta?
So I am going to admit to being one of those people who Google. And so I fully acknowledge it. And so, and I don't discourage people from doing that. I agree with Dr. McCoy. I think people should use every resource they have available to them. Mm-hmm. And then, because we also can't assume that, we already know that everybody doesn't have the same level of education, understanding, really awareness of what they see online means, or what they hear from their aunt, their cousin, their sister, their friend, who will tell them things as well. So I encourage people to, let's actually talk about health. Let's actually talk about our kids' health, because a lot of times things don't get, we don't get answers, or we don't get better understanding because we hold things. We hold things in, and we don't ask people or tell people. And so whoever it is that you trust, if it's your mentor, your child's mentor through a program like the Chicago Urban League offers, or your housing counselor, or your workforce trainer, whatever it is, let's ask. And we will always, we are not medical professionals at the Chicago Urban League. That's not what we do, but we certainly can connect you to someone.
Yeah, well, I want to thank you all. I've learned so much tonight about vaccines and vaccinations. Y'all have definitely put me at ease. So thank you for that. And I too am a Googler. So I can admit that.
We all do it. Yes.
But I want to thank you all for joining us for the 3rd annual Healthy Kids Summit, Vaccines and Vaccinations, What Parents Should Know. I want everybody else to stay tuned for the next panel that's coming up, Black Children and Mental Health, at 7:00. So thank you all for joining me. And of course, you've got to come back.
Thank you so much.
Thank you.
Such a great group. Thanks so much for the invitation.
Yeah.
Thank you.
I'm honored to participate. Thank you.